Welcome back to Toledo Clinic TV. Dr. Marie Wolfe is with us now. She's a primary care physician, internal medicine specialist. Thank you once again for being with us.
You're welcome.
There are a lot of choices out there for patients, and so when they're trying to figure out who they want to have as their provider,
right,
what do you tell them? How do they choose someone good?
So, I'm just so pleased that I'm part of the Toledo Clinic. I think we have a great team of primary care physicians. We have expanded with, we have nurse practitioners, we have physician assistants, and we have great specialists that we can access. We have support services, laboratory, we have x-ray, we have physical therapy. I'm also a registered pharmacist. We have a pharmacy and we have an ambulatory surgical care center. So we feel we add quality, value, and access in a way that is special. We are a physician-owned and operated healthcare system, so we feel that we can pivot more quickly and that we as physicians are dialed in. We are our own leadership and we can meet the patient's needs quicker, sooner, and better, and with better quality and value than some of the other healthcare systems.
Access is a huge thing,
It's a huge thing.
You have just launched this My Toledo Clinic Nurse.
Yes.
Tell us about that briefly.
Right, so we are just trying to meet the patients where they are and know that everybody's busy, and we're trying to look at this as a 24/7 service. So the primary care physicians have on-call services, and this is a nurse line with registered nurses that are part of our team that after hours during the week, holidays, weekends, that this is a service that the nurses are there waiting. They can access your healthcare information. If you're a primary care patient at Toledo Clinic, and we invite you to join us because we're offering services where we can get you in with a new physician within 24 to 48 hours. And this nurse line is something that we're just offering to patients where a nurse is there to help problem solve through what your concern is after hours. Do you need an urgent care? Do you really need to go to an emergency room? Or can we avoid those steps of unnecessary cost and time commitment and get you in with one of our primary care team members and start the process of what needs to be done? Access our schedule, put you in, hey, Heather, does 10:30 tomorrow morning work? You're in, and we'll see you then, and we'll go forward and connect you with all the services that we have at the Toledo Clinic.
Tell me how important it is for patients to have a connection point, to have a primary care physician who's overseeing all of their care.
Yes, it's very important because we're kind of in the center of it all. It's not to say that there isn't extreme value in the specialists that we work with, but this is where we really want to begin, and we're the center of the spoke, and then we can, decide, do we need laboratory? And we've got great laboratory services with the Toledo Clinic. Is it something that we want to refer you to physical therapy and then see you back? Is this helping? Do we need a specialist right then and there? We've got multiple specialty teams that we can connect with seamlessly. Do we need a procedure at an ambulatory care center? We have one on Toledo Clinic's campus, Secor Road, that's been award-winning. And so we've got individuals, our pharmacies there. What do we do next? And just problem solve together with you, starting with us. We want you to be using us as your go-to. Let's start at primary care.
Yeah, that makes perfect sense. Thank you so much for being with us.
You are very welcome.